Now we're going to look at the AIDS and the related opportunistic opportunistic infections. So under this, we are going to see the opportunistic infection as well as the neoplasms. To start off with a few questions, what are the fungal infections associated with AIDS? So this is the question 1. Question 2 is, what are the viral infections associated with AIDS? Question 3 is, what are the neoplasms associated? So we'll find out the answers to all these questions, and there's a bonus questions at the end of the video. So firstly, starting with the infections. Infections, if you see, they are classified into, there is a protozoal and helminthic. Next, there is the fungal infections. After that, there is also the bacterial infections. Next, there is the viral infections, and there are also a different class of neoplasms. So this being said, firstly we are going to start with the protozoal. So in the protozoal infections, the first thing we need to note is that it is a cryptosporidiosis, or the isosporiasis. That is the cystoisosporiasis. It is the chronic intestinal. The next, under the protozoal helminthic infections, it is the toxoplasmosis. Toxoplasmosis. So under toxoplasmosis, it includes the pneumonia as well as the CNS infection. Then we move on to the fungal infections. So what is the fungal infections? So this includes the candidiasis. So under candidiasis, it can involve the esophagus as well as the trachea, and also the pulmonary types. Next, after candidiasis, it involves also the cryptococcosis, and this involves the CNS. Then looking at the coccidioidomycosis, and this it is disseminated. After this, there is the pneumocytosis. So under pneumocytosis, it also includes the pneumonia as well as the disseminated infection. Then under the fungal infection, it also includes the histoplasmosis, and this is nothing but it is disseminated. Next, what we see is the bacterial. So the bacterial infections. So under the bacterial infection, we have the mycobacteriosis. So mycobacteriosis is nothing but it is atypical. Mycobacteriosis is atypical. So what is the example of this? The example of this, it includes the Mycobacterium avium intercellular layer, and this is disseminated. It is disseminated, or it can be extra pulmonary. Then bacterial infection, it also includes the Mycobacterium tuberculosis, and this includes there is the pulmonary as well as the extra pulmonary. Then comes the nocardiosis. So under the nocardiosis, this includes the pneumonia, meningitis, as well as disseminated. The next bacterial infections includes the salmonella and infections, and it is disseminated. Post this, we also look at the viral. So under the viral, there is the cytomegalovirus, that is CMV. So here it includes, there is the pulmonary, then it also includes the intestinal, it includes the retinitis, also the CNS infections. So after this, it includes the HSV as well. HSV stands for the herpes simplex virus, and this is it is localized as well as it can be disseminated. Then we look at the varicella zoster. So varicella zoster virus, it is nothing but it is localized as well as the disseminated. Then we look at the progressive. We look at the progressive multifocal leukoencephalopathy. So post this, we go on to the neoplasms. So neoplasms. So under neoplasm, there is the Kaposi sarcoma. Next, there is also the primary lymphoma, and this is of the skin. And post this, it includes the invasive cancer. This is of the uterine cervix. So now we go on to answering our questions. So the first question we asked was, so looking at the answers, the first question we asked was, what is the fungal infection? So under the fungal infection, we saw there is candidiasis. So under candidiasis, it can affect the esophagus, the trachea, as well as the pulmonary. Then we saw there is the cryptococcosis. So under cryptococcosis, it is involving the CNS infection. Post this, there is also the coccidioidomycosis. So under this is disseminated. And after this, there is pneumocystosis. And this can relate to the pneumonia or the disseminated infection. And after this, there is also the histoplasmosis. This is nothing but it is disseminated. Then we move on to answering our next question. That is, first we saw the fungal infection. Then we are looking at the viral infection. So what is this viral infection? The viral infection, it includes the CMV. CMV is nothing but the cytomegalovirus. So this affects the pulmonary, it affects the intestinal, and it also infects the retinitis and also leads to the CNS infection. So beyond this, the virus, it also includes the HSV, herpes simplex virus, and it can be localized as well as it is the disseminated infection. And then we have the VZ, that is a varicella zoster virus. This is again, it can be localized as well as disseminated. And we also have the progressive multifocal leukoencephalopathy. So the next question we asked was, question 3 was neoplasms. What are the neoplasms associated? So it includes the Kaposi sarcoma. Next, it also includes the primary lymphoma, the primary lymphoma of the brain. Next, it also includes the invasive cancer of the uterine cervix. Now, after answering, now we look at the bonus questions. So these bonus questions can be answered in the comments. So under this, there is, first question is, what are the protozoal infections? Protozoal opportunistic infection in AIDS. Second question is, what are the bacterial infections? The third question is, what is the incubation period? What is the incubation period of AIDS? That's HIV.